Hi, myself Dr. Sheena. Today, our topic for the discussion is pulpal diseases. So, pulpal diseases, we know that pulp is actually a delicate connective tissue which is enclosed within enamel and dentine, and there are large amount of blood vessels, lymph, unmyelinated and myelinated nerve fibers within this closed space. So, any insult to the pulp, which might be in the form of a physical, chemical, or biological effects, might bring about a change or inflammation of the pulp, and that is called as actually pulpitis. So in this PPT, like we'll be dealing with the pulp, the various aspects of the inflammation of the pulp, which often lead to the periodontitis, and the sequelae of infections is dealt. And certain important things that you need to actually memorize is like what is the average intrapulpal tissue pressure. The intrapulpal tissue pressure normally is 10 mmHg. We know that the dental pulp often actually consists of movement of vascular supply, vascularity inside that. So because of the movement or because of that, there is a pressure being built up, and that is normally 10 mmHg. Because of certain inflammation, because of certain insults, there is inflammation taking place, and the pressure might change from 10 mmHg to 13 mmHg. And this is a condition where we can bring, or the pulp is able to repair by itself, and that is 13 mmHg. When it reaches 13 mmHg, we can come back to its normal pulpal state. But if the intrapulpal pressure changes to 33 mmHg, that is a condition which often leads to irreversible changes, and we cannot actually bring back to its normal position. So that is 10 mmHg is the normal. Till 13 mmHg, we can it is an inflammatory stage, but it can brought back to its normal condition. But once it reaches 33 mmHg, it's really difficult for actually controlling or bringing back the pulp to its normal position. So what are the causes of pulpal diseases? Physical means, of course, the most commonly seen problem or the etiology, that is dental trauma. Because of trauma, there is exposure of the pulp, and if it can often lead to the infection of the pulp. Next is chemical. Whenever we do a restoration in a pulp, so this is actually the pulp. Whenever we do a restoration and the pulp is so nearby, if it is not protected by a base, liner, or varnish, etc., what happens is like the corrosion products or the materials from this restoration can come down to the pulp, and it can often lead to the necrosis of the pulp. So we cannot actually do a unprotected restoration which can affect the pulp, or which can often lead to the pulpal disease. Next is bacterial. That is the most common. We know that dental caries is a microbial disease which is responsible for the movement of caries from enamel dentine encroaching to the pulp and the periodontal space. So these are the causes of pulpal disease. Certain important things that you need to keep in mind when you attempt the NEET MDS PG exam is, we know that during tooth preparation or during cutting of the teeth, the burr produce heat and temperature is raised. So what happens is like this might actually have an effect on the pulp. This temperature which is produced by the burr might actually affect the pulp, and you need to memorize that if it is more than 11 degree Fahrenheit, that can cause a destructive reaction to the pulp. So always whenever we cut a tooth, it is very important to use coolant. Coolant like water should keep on spraying on the burr or the material, so that there will be no destructive response taking place on the pulp. Another important thing is the revolution per minute, the speed at which the burr rotates. The speed should not exceed beyond 3000 rpm. If it is less than 3000 rpm, we can actually prevent the destructive reaction that is taking place on the pulp. But if it is more than that, there might be certain changes that will be taking place on the pulp. And pressure is also directly proportional. More the pressure to the tooth, it will have effect on the pulp, right? And surface contact, again, more the surface contact, it will have a bad impact on the pulp. So it is very important to give an intermittent pressure and intermittent surface contact to the tooth, so that the amount of energy or the amount of pressure which we implement on the pulp is decreased and it is saved. Another important term is barodaryngia. Barodaryngia is also called as aerododalgia, which what does it denote is like it is a toothache which occurs when there is a change in the atmospheric pressure. Either when in flight, when there is a change in the atmospheric pressure, where there is low atmospheric pressure, the patient often experience such a condition. This is called as barodaryngia. You have to keep this in mind. Next is the sequelae of pulpal diseases. So you can see in this image, the caries have involved a tooth which have involved a pulp. From that, there is complete necrosis of the pulp. That is called as pulpitis. That is the inflammation of the pulp. From pulp, it moves to the apical foramen, to the periodontal space, that is called as periodontitis. So this is the main sequelae of the disease, right? So normal pulp, because of various stimuli, it causes inflammation leading to the first stage reversible pulpitis. As I said, there will be slight change in the intrapulpal pressure, about 13 mmHg. So reversible pulpitis means the pulp can be brought back to its normal condition when we remove the stimulus that is causing that pulpitis, right? And if still the stimulus or the etiological factor is continued, the reversible pulpitis get converted to the irreversible pulpitis. And the irreversible pulpitis is again of three type: chronic hyperplastic pulpitis. We keep on placing that etiology over there. What happens is like a cauliflower like proliferation take place on the tooth surface like this. It is called as a polyp or hyperplastic pulpitis. Sometimes it can actually lead to symptomatic irreversible pulpitis, means that the patient will be having continuous pain. That is symptomatic. It can be asymptomatic over a period of like after 1 month or 2 months. There will be the conditions of irreversible pulpitis, but the patient might not have pain. That is asymptomatic. Patient is asymptomatic. So sometimes it might lead to the resorption. If this is actually the root, there might be slight resorptions taking place. This is internal resorption, and after that it leads to actually pulpal necrosis. After pulpal necrosis, the next stage is periodontitis. So these are the sequelae of pulpal diseases. Now the first condition, that is reversible pulpitis. Another name is hyperemia, or so called as hyperactive pulpalgia. Very important. Pulpalgia means pulpal inflammation or pulpal pain. These three important terms need to be kept in mind. So what is reversible pulpitis? As you know, that dental pulp is often affected by a caries. There will be inflammation of the pulp. So how it is called as a reversible pulpitis? The patient will have a moderate to mild inflammation of the pulp. Okay, and when a stimuli like suppose a cold, we ate a cold food like an ice cream, the patient had a sudden pain. But when I removed the stimuli, like when I actually stopped eating that ice particle, the pain went off. That is reversible pulpitis. Means the pulp had a certain irritation, but it came back to its normal condition once the stimulus was removed. That means the pulp is healthy. In order it can come back to its normal position. That is actually reversible pulpitis, where the pulp is able to return to the uninflamed state or to the healthy stage once the stimulus is removed. That is what you need to keep in reversible pulpitis. It is like because of mild to moderate inflammation is seen. 1, it can come back to its normal position. 2, all the three important names that you have to keep in mind. Next is like, what are the reason for this reversible pulpitis? Think like we have done a restoration. The patient might actually come after 2 days and say that I am having pain after I did the restoration. So what we do is like we'll be checking the tooth. Sometimes we might see high points. High points means there are actually super occlusion. This might be the normal occlusion. There, when we did the restoration, there might be excess of restoration placed on the tooth, and when we actually bite on that, the pressure will be coming on that and towards the pulp. That causes pain. So when we actually remove the excess, the pulp will actually come back to its normal position because the stimuli is released. And a certain blow or trauma may also be a reason for pulpal inflammation, but after sometimes or when we give a rest or something, the pulp will come back to its normal position. chemical irritant to the pulp. For example, when we have done a restoration, what happens is like, if we are not protecting the pulp, there might be slight leakage of the chemical substances to the pulp, which causes a slight irritation. When the slight irritation starts, just remove the irritant and it can come to its normal position. Dehydration is another method which can lead to reversible pulpitis. As I said earlier, if we cut the tooth and not providing proper water supply, or we are doing it in a dry condition, the tooth will have a bad effect on the pulp, which often elicitate as a pain. But once after 2 or 3 days, the pulp will come to its normal position. This is actually the etiological reason for reversible pulpitis. You can see in this image, first because of trauma, second is like hyperocclusion. You can see in the third image, we have to actually reduce the hyperocclusion areas and the pulp will come back to its normal position. And fourth image, see the dental amalgam. When we provide a dental amalgam, we have to give pulp protection. Otherwise, what happens? This amalgam leaches out. It will have a deleterious effect on the pulp. So these are the etiological features. So what are the classical clinical features? Just think, cold food, very important. Just cold food items make the tooth sensitive. That is reversible pulpitis. No other stimuli. If a patient is saying, I'm having difficulty with hot food, that means that it has moved to irreversible pulpitis. Cold means we normally have like I have a sensitivity when I eat certain ice cream. That is a normal feature. That is a reversible. Pulp is slightly inflamed. That is a reversible feature. Cold, and the pain is of very short duration. Once we remove the stimuli, the pulp is normal, right? Now this is mainly seen in young people. So what is the diagnosis like? Normally there is no radio, very important, there is no radiographic features seen. Everything, all the diagnosis part is like palpation, percussion, mobility, everything is normal, and the only thing that patient will complain is like, I have sensitivity towards cold items, nothing else. If it moves into hot item, it will move into the next condition, right? So what is the treatment? This is the question from which you will get the treatment part. Acute reversible pulpitis is treated by. Does we need a treatment? No, because that is actually condition. When we give a irritant, the pulp started to react. Once we remove the irritant, the pulp will come back to its normal position. So simple. Sedative filling and watch and wait. That is the only thing that we need to give. What is the irritant? Remove that. Give a sedative filling. Just wait and watch. That is the answer, right? Next condition is irreversible pulpitis. That is a pulpal inflammation have gone to a stage where the pulp is not able to repair or come back to its normal healthy position even after we remove the stimuli. See, it is a persistent inflammatory condition. The other was not persistent. Very important, hot, cold stimuli. That is very important. Patient is saying that I'm having difficulty when I take a hot food. Just think that it is irreversible. Pulp is not able to come back to its normal position. And the pain will actually persist for several minutes and hours. Even after we had a hot food, we started pain. Even after I stop eating, the pain persists for sometimes like minutes or hours. That is irreversible pulpitis. So simple. Okay. So main difference, pain. Reversible pulpitis, even though it is sharp, stimuli removed, it stopped. Irreversible pulpitis, even the stimuli removed, we have pain continuously, right? Pain at night or not. What happens is like, when we are in a straight position, the pulpal pressure is less. When we actually move in a nocturnal position, in nocturnal time, night, we'll be actually lying down. So what happens is like, there will be more influx of like blood to a particular area. There will be increase in the intrapulpal pressure and the patient will feel heavy pain. So when a patient come to you and say that when I sleep or when I go for a sleep, I am having an increased pain, just think that that is a feature of irreversible pulpitis. Okay, the pain is increased, that the pulp is not able to actually defeat or defend the stimuli that is responsible for the pulpal pain. So simple. Night pain means irreversible pulp. Cold, only reversible pulpitis feature. Right. Referred pain means sometimes the tooth will be here, but the pain might be actually referring to the nearby areas. Referring pain is also a feature of irreversible pulpitis. Referred pain is not seen in reversible pulpitis, right? So again, when we actually give the test, I said earlier, most of the cases, all the tests will be normal, or as premature response will be actually seen in reversible pulpitis. But in the case of irreversible pulpitis, there might be delay. Okay, there might be a delayed or premature or a mixed. Sometimes we apply the electrical pulp, the patient shows exaggerated response, showing that the pulp is so inflamed, it is showing exaggerated response. Everything will be exaggerated. If it have gone to necrotic, there might be no response. Understood? Color change. No color change is seen in irreversible pulpitis. There might be slight color change in the tooth in irreversible pulpitis. A radiograph, most of the case, pulpitis, there will be no. If this is actually the tooth, pulpitis means the pulp is within the tooth. So there won't be no change, no or much changes in the periapical area, or slight change will be. Most of the cases, there is very less change in the periapical area, right? So this is one question. Patient reported with severe throbbing pain in relative to mandibular second molar. The tooth is sensitive to both hot and cold food. From that itself, we came to know that it is, if patient told that it was cold food, we will conclude that it is reversible pulpitis. Since it is hot and cold food, we should come from reversible pulpitis have changed to irreversible pulpitis. And what would be your treatment of choice? Elicit a painful response to percussion. Percussion means there, when we actually tap the tooth, there is a slight pain in the periapical area. That means that the pulpitis has gone into the periapical area. It is moving into a slight first stage of periodontitis have started. So what would be your treatment portion? So we know that pulp, once infected, it is not going to come back to its normal position. We have to do the root canal treatment, or endodontic therapy has to be done. So that is the treatment part. Okay. In a patient with acute pulpitis, it is difficult for the patient to locate the pain. This is because, this is a very important portion that you need to know. So as I said earlier, there are something called as propion receptors present. As I said earlier, propion receptors are present only on the periodontal space. On the periodontal space only, there are propion receptors present, and there is very less propion receptors present in the pulpal area. There is very less propion receptors present in the pulpal area. So, acute pulpitis, it's difficult for the patient to locate, because pulpitis means the pulp is only having the necrosis. Is there any propion receptors present? No. So, it is difficult for the patient to locate the pain. That is because, so why the patient is not able to locate the pain? Because the number of propion receptors is less in the pulp. If it had gone in the periodontal space, patient have felt proper pain, saying that the pain have moved to the periapical area. That is why patient able to properly locate the pain. Okay, propion receptors are less in pulp, more in the periodontal space, right? Next stage is chronic hyperplastic pulpitis, otherwise called as pulp polyp. So what happens, as you can see in this image, what happens is like in young people, they will show certain exaggerated response or inflammatory response of exposed pulp appearance. This is because of the low grade inflammation. That is very important. Low grade irritation leads to such kind of chronic hyperplastic pulpitis, where there will be a pink color or cauliflower appearance tissue which is covered by epithelium, and this is mainly because of a long standing scenario, right? And what happens is like, it is mainly symptomless. In most of the cases, we'll see like a red cauliflower appearance, and only pain is seen when patient masticates. Sometimes the upper tooth come and actually touch on that granulation tissue. Patient might actually feel difficult, and sometimes the surface also get ulcerated. In those cases also, ulcerated cases also, patient might get pain. Otherwise, it is a normal condition where pain is not seen. It is symptomless. What is the treatment? Of course, pulp is inflamed. We have to go for extirpation or a root canal treatment, where we'll be using spoon excavators to remove the involved or inflamed granulation tissue. Further, we'll be opening the chamber. We'll be doing the root canal treatment. That is the treatment part of this hyperplastic pulpitis. Next important topic is internal resorption of the pulp. The internal resorption of the pulp is also called as internal granuloma odontoclastoma, and pulp tooth of mummery. This is very important, a pink tooth of mummery. So the question may be, what is pink tooth of mummery? Pink tooth of mummery means there is pinkish discoloration in the teeth. In which condition? Internal resorption. That is because what happens is like when inside the pulp, when there is inflammation, sudden inflammation that is actually moving, what happens is like this inflammation might affect the dentine and enamel on the outer surface. So there might be resorption or the macrophagic action taking place, removing the dentine from the outer surface, creating a radio loosened area. So this is called as internal resorption of the pulp, and this is a very fast progressive process, and this is often showing a chronic inflammation over a long period. That is why chronic. It is not a single day procedure. It is over a long day procedure taking place. You can see in this image there is pink discoloration. This is pink tooth of mummery or pink spot. What does it indicate? When some question is asked like pink spot often indicate a pulpal necrosis, a pulpal resorption. That is because we know that our tooth is covered by enamel, dentine, then only the pulp comes. So what happens in resorption? There is eating of the dentine, there is removal of dentine. So the pink color of the pulp is easily seen through the wear of tooth. So that is why it have a pink spot appearance. Another important thing is the classification that was given by Heather Say for the invasive cervical resorption. You can see in the cervical part there might be a resorption taking place. So invasive cervical resorption class 1, as you can see in this image, there is a small invasion that is seen on the cervical area which is very shallow. That is actually class 1 is there. When there is class 2, it denotes a well-defined invasive lesion which is near to the coronal pulp. This is the coronal pulp, this is the radicular pulp, which is very close to actually the coronal pulp. It is actually class 2. Class 3 denoted deeper invasion, you can see, and there is slightly completely involving the coronal area and slightly involving the 1/3 of the root is class 3. Class 4 is the entire coronal and radicular root has been involved. So the type 1 is the resorptive area which actually involved the cervical area. Now it is completely involving the coronal area and slight of a radicular area, complete radicular area and coronal area has been affected. Next question is internal resorption in a tooth is seen as. It is actually, of course, a non-proliferative lesion. Right. So that was a sequelae we studied till now. Pulpitis of two type, irreversible pulpitis and reversible pulpitis. Pulpitis often leading to chronic hyperplasia or cauliflower-like appearance, and it can be another like pulpal degeneration may also be actually seen. Degeneration means sometimes the pulp might have certain conditions because of the long-term irritation that is persisting, right? This is mainly seen in older people. Hyperplastic pulpitis was seen in younger people, but pulpal degeneration is seen in older people. That is because of the persistent mild irritation to the younger tooth. What happens is like initially there might be no signs and symptoms. For example, over a period of time, sometimes patient developed a calcification. What happened? But it is often shown as discoloration of the tooth. Over a period of time, the patient may come with a discoloration of the tooth, or there is no stimuli. Patient say that I feel nothing on this pain. No response to stimuli is also another feature of degeneration. There are five important things or types of degeneration. First is calcific degeneration. That is a pulp stone that is mainly seen. Fibrotic degeneration. Before moving into the calcified structure, there is fibroid-like pulp. So this is a pulp. Normally it is lined by large amount of connective tissue. Beyond that, it becomes slightly hard. That is fibrotic degeneration. Next is atrophic degeneration. That is the before stage of actually fibrotic. Pulp artifacts and tumor metastasis. These are the 5 types of degeneration. In that, the most common is calcific degeneration, also called as pulp stones. Very important. The other name is pulp stone. So pulp stone means there is a calcific mass, as you can see in this image. There is a calcific mass that is actually seen in the pulp chamber. That is because of the irritation. What happens is like there are laminar structures onto which small calcium and phosphate get deposited, and it might get attached to the wall, or you can see as in this image it might lie as a free structure, right? So based on the position, it is of three type: free, attached, or there it might be embedded. And sometimes it might be true, like the similar composition of enamel and dentine, and false where it is not having the same composition of enamel and dentine. Right, that is the classification of pulp stone. So what is the calcification of pulp? What is the answer? Is in response to aging, does not relate to the periodontal condition, precedes internal resorption, indicate presence of additional canal. Not the last three, is in response to aging. Already we know calcification or degeneration is because of actually aging. So talking about the pulpal diseases, what you need to know is like pulp, the pulpal pressures, the what are the etiology that is responsible for the pulpal degeneration, the various sequelae of pulpitis, irreversible, reversible, going to the like polyp, the internal degenerations like calcifications, etc. Till this sequence actually show the pulpal changes. In that, reversible pulpitis just cold, irreversible pulpitis cold, hot, nighttime pain will be exaggerated. Similarly, on tender on percussion slightly present, and patient will have pain even after we remove a stimuli. Chronic hyperplastic pulpitis we can see as a cauliflower like growth outside, and radiographic changes like calcifications often shows the later stage of pulpitis or long standing inflammation or irritation. And in between that, sometimes it may also move into resorption. Resorption, the classical feature is pink tooth. Pink tooth of mammary is a classical feature of internal resorption. Internal resorption, how we treat is like we can actually, this is actually the internal resorption that is actually taking place in the tooth here. What we do is like we will be doing the root canal treatment where we'll be actually removing all the pulp. We'll be filling this with actually gutta percha. Before doing the gutta percha filling, here we will actually either reflect the flap and do a MTA obturation. There we'll be filling it with MTA. We know that mineral trioxide aggregate is a silicate like material which consists of large amount of silica, calcium phosphate, etc., which actually have the structure which have the strength is that of enamel and dentine, and it can resist the moisture contamination, etc., can be the ideal material for filling this resorption areas. So internal resorption is treated as such. Calcification, again, because of long standing feature or a important character of aging people, and this how we need to treat is like while we do root canal treatment, we have to use files to actually take off the calcification, then only we will actually move on to the root canals for completing the root canal treatment. So thank you. That was all about the important terms and terminologies and the important points that you need to actually keep in mind just when you deal with the pulpal diseases. Next, we'll be moving to the periodontal disease in the next presentation. Thank you.